Hello, welcome to Motivational Interviewing for Physical Therapists. I'm Shelley Kind. I'm a fifth year clinical psychology PhD student, and part of the reason why I'm giving this presentation, in addition to motivational interviewing being one of my areas of interest, is that I spent a year working in behavioral medicine, and part of that time was spent at the Ryan Center at Boston University, shadowing their physical therapists, collaborating with them, doing joint visits. And so one of the things that came up often were questions about motivation and motivational interviewing. I gave a version of this presentation to their staff, and they enjoyed and expressed benefit from it. So I'm hopeful that you all will take something away from this as well. So since I can't be there live with you, I'm going to try to make this as interactive as possible. Please grab a piece of paper and something to write with, and we'll have some little interactive bits along the way. So you can pause the video now to grab a piece of paper and a pen. To start with, just wanted to give you a chance to jot down, what do you know about motivational interviewing? Something led you to choose this webinar. Write down a few notes about things you already know, what you've heard in trainings, classes, from your colleagues, and you can pause the slide here to jot down some of those notes. So, motivational interviewing is a person-centered counseling style for resolving patients' ambivalence about change. And what this really means is that we all have had patients come in who tell us they want this change, but we are not seeing the behaviors that would make the change happen. And we're left wondering as providers how to better serve this person, how to engage them. And this is a really client-centered, compassionate, partnership-based approach to resolving that ambivalence about change. MI, how is it helpful for physical therapists? So 80% of studies show that MI has better outcomes than advice giving. And MI provides an advantage over other interventions in many areas of behavior change across medical settings for improving sedentary behavior, confidence in change, approach to treatment. And then in physical therapy settings, it's been shown to increase compliance with exercises, improve physical functioning, improve patient adherence and motivation. So there's a lot more research out there if you'd like to check it out, but I just wanted to give you a little sampling of how many domains motivational interviewing can touch and improve. So before we jump into skills, and believe me, we'll spend some good time working on skills, I wanted to go into the spirit of motivational interviewing. So this is basically the attitude with which you use any of the skills that we're going to learn about. So the spirit of MI is partnership, it's acceptance, compassion, and evocation. And partnership is this idea that motivational interviewing is not done by an expert to a passive recipient, a teacher to a pupil. It's not done to or on someone at all. It's done for or with your patient. And this matters because we all as humans have this writing reflex where we love to hear a problem and solve it. Maybe you've had this happen at Thanksgiving where you've complained about something, your uncle across the table goes, oh, well, if that's your problem, let me tell you how to fix it, and rattles off some advice. But your uncle doesn't know all of the components of the problem you're dealing with. So maybe the advice he gave you was something you already tried. And so his advice feels really patronizing, that he thinks you haven't thought of that. Maybe you feel invalidated. Or maybe his advice just really doesn't work because he doesn't actually know the situation that your problem, the context of your problem. So while we all have this writing reflex, it can make us less effective. And being in a true partnership with our patient, understanding their value and what they bring, reduces our writing reflex and allows us to roll with resistance as well. That's another key component of motivational interviewing, which is this idea that instead of when we hear the patient going, well, I'm really not interested in going on a daily walk. And you're like, we need this exercise. Instead of pushing back against it and telling them all the reasons why that daily walk is so important, we go, so daily walk feels like a really impossible task right now. And you just roll with that resistance that they've expressed. And then that sometimes can allow them to step up and say the opposite, go, well, maybe not impossible. And then you have a foot in the door because they're telling you this is not impossible. So being able to set down our writing reflex, roll with resistance, and truly be with our patients is great foundation for the skills that we're going to learn. Acceptance is another piece of the spirit of motivational interviewing. And this is trying to understand the other person's perspective, believing that understanding their perspective is worth something, believing that this person has innate value, affirming the person, seeing their strengths, and sharing that with them. Because oftentimes with, say, chronic pain, there are a lot of mental health comorbidities that go along with that. Maybe this person has depression or post-traumatic stress disorder, and they're not really in a space to be noticing their positive qualities. You, as their provider, can note some of the things that they're doing well and highlight those for them. And then together in a partnership, you can use those strengths to move forward and make some of those positive changes. Compassion. This is about a commitment to pursuing the best interests of the client. I was trained in evidence-based therapies. That is completely my background. I imagine for many of you, the evidence base of a therapy feels very important. And sometimes the adherence that we have to evidence-based therapies can make us rigid. And again, pull out that writing reflex. So you kind of want to be watching for that and attuning yourself to the best interests of the client. Just because the outcomes in our RCTs, our randomized controlled trials, are what we might orient ourselves towards, maybe our patient is letting us know that they have some other need. And you want to be able to think about how to integrate that person's need into your care to pursue their best interests. Maybe that's, twice a month sessions instead of weekly sessions that you think they should be getting. And how do you balance their needs and their interests with where you both want to go? Evocation. Instead of the typical medical model of, I see what you're lacking, I'm going to instill it in you, we assume that people are already equipped with what they need and that it's our job to bring out that knowledge or skill. So if you think of folks who are overweight, people sometimes be like, well, you just need to eat more veggies, you need to exercise more, less dessert. And again, that's that writing reflex, right? We want to solve the problem. But instead, this person has probably heard those pieces of advice before. They probably know some things that they could be doing to lose weight. So instead of throwing a bunch of advice at them, ask them about what they know about weight management strategies, what they've tried before. Try to pull out some of that knowledge that they already have. What might be your first step in thinking about managing your weight? So now that we've gone over this foundation, the spirit of MI, we'll move on to some skills. The OARS skills are some of the most basic skills in motivational interviewing, and these are open-ended questions, affirmations, reflections, and summaries. So we'll go through each of these, but in short, open-ended questions are questions that can't just get a yes, no answer, but instead give the patient a chance to speak more on the topic. Again, evocation, sharing what they know with us. A is affirmations. This is highlighting the person's skills, things that they're doing well. What are they doing that's working? Reflections, this is kind of the natural ping pong in a conversation that you would hope to see where the person is sharing and you're able to reflect back some of the main points or themes that they're making. Maybe you reflect back an emotion. And then summaries are kind of a big reflection that happens at transition points in a conversation where you want to let the person know that you've heard all of this information you've given them and you want to distill it down to a couple of key points, kind of being thoughtful about what points you might choose to summarize in order to promote change. And then that's a way of letting them know you've heard, letting them correct you before you move forward. So we'll spend a couple minutes on each of these. You can see in the red box, just to start with, these are closed questions. These are questions that we've all probably asked, whether about therapy exercises, PT exercises. We ask them, will you do these, or are you doing them? And you're just getting yes, no, most of the time. So we want to switch over to the side of the slide where we have those green arrows, asking questions that allow for the patient to share more. The first one, what was that like for you, is a lovely question when you feel a little out of your depth. The patient is sharing something that you're not really familiar with and you're not quite sure what the right response is. You might ask what it was like for them as a way to show that you care and that you want to better understand their experience. So if somebody comes in from a car crash or an assault and that's why they're in physical therapy, if you don't have mental health training or feelings are a little uncomfortable sometimes for you, then that might be a weird space to be in and wonder how to serve this person. So asking an open-ended question is a great way to show your respect for the person and your desire to be with them in this experience and processing it. How does the pain affect you? This question can help you understand domains that might be goals for the person. Maybe they're saying it's really affecting all of their relationships and their ability to paint because they love painting as a hobby. You might log away, okay, relationships, painting, and keep that in the back of your mind for when you need to beef up motivation, when you want to reflect then back something that you've heard to emphasize, like, yeah, these are things you care about. And here's how we might tie this exercise to getting up your strength or mobility for painting, and allow you again to attune to their goals, that compassion piece of the spirit of MI. How would you like things to be different? Again, this tells you where their priorities are. In that compassion piece, this is going to help you know where to direct your time in treatment. You can ask, what's been getting in the way of doing these exercises? This is evocation about the patient sharing important information that they have about why this isn't working, instead of us guessing as providers, well, they have a few kids, maybe the kids are getting in the way. Maybe it's something totally different. Maybe their mood is just really low and they're really struggling to get anything done. So it's an internal barrier instead of an external barrier that we were looking at. Why do you want to make this change? I love this question. This is an awesome way to turn the whole conversation on its head, instead of us as providers saying, here's all the research about why you might want to do this thing, and I'm going to tell you why this is important. Give that work to them. Let them tell you why they care about this. Why are they coming to physical therapy? What keeps them coming in, even though none of those home exercises are getting done, even though they tell you they feel hopeless? Like, why do they want to make this change? What have you tried before to make a change? This question is helpful for a couple of reasons. The first is it allows you to maybe learn some things that weren't in their treatment history. Maybe you saw a few things in their referral info, but they've actually tried shots for the pain. They've tried surgery. They've tried acupuncture, and none of those things were listed in there. So that gives you concrete information about how you might want to help them. The other thing that it gives you, at least for me, is when I was seeing patients with long histories of chronic pain, their treatment history was just as long. They would run through, years, decades of trying everything you could think of. Sometimes pain treatments I had never even heard of, they had tried and truly invested in, financially, time-wise, emotionally. They really showed up for these treatments and they didn't get good gains out of them. And so I notice myself when I hear that, like, I feel disappointed, I feel frustrated, I feel sad for this person. There's nervousness about, is this new treatment going to work that we're trying together? So that gives us a little bit of empathy for the patient, of understanding, if they're difficult in session and they're kind of giving you a hard time, and we as providers might be getting a little frustrated, we can come back to remembering, okay, wow, they've had quite a treatment history. It really hasn't panned out for them. I can get why they'd be a little irritable in session today. And then what is the next step for you? Again, with the evocation, we are getting a sense of what patients know might work for them. So when you're asking this allows the patient to tell you where their head is at, and for you to calibrate over what a reasonable next step might be. So they might have a next step that addresses a barrier that you hadn't thought of. So say you asked what's getting in the way of doing the exercises, and you had this whole thought about, their kids and time management and all these concrete external things, but it had been a mood issue. So then when you go to what's the next step for you, maybe they say, I think I might need to talk to someone about my depression. That's a very different next step than what you might have come up with if you were operating under the assumption that there were external time management barriers. So again, the person's going to feel more motivated if the idea is coming from them, and often it'll be their next step will be more related to what probably really is going on there than what we as external people who have less data might think needs to happen. And if you really don't agree with their next step, fine. Like, then that's something for you to explore together to better understand why they're choosing that as the next step. And that's something you could ask, like, okay, so your next step is going to see maybe a mental health provider. What led you to feel like that step is going to be helpful in moving forward? And truly ask these things with curiosity, with openness. People will pick up on if you have a little plan in the back of your mind for why they're wrong and how you're going to help them see it. they're going to know that that's what you're doing. So try to really be open to seeing their wisdom and what they have to share with you. Affirmation. Again, like we talked about, affirmation is this beautiful part of MI where you get to highlight all the things the person's doing well. It's really fun, and it's great to watch people light up or lean into their strengths when you do this. I've definitely seen people who come in feeling like this treatment is going to do nothing for me, and I am worthless, and you as my provider are worthless because every other provider hasn't helped me. And it's a brutal start to working together. But listening to the person talk about their partner or how they supervise people at work, you get this window where you go, wow, you're incredibly tuned into how other people are feeling. And you really think about how to leverage that at work. And the person just lights up. Maybe they're a little embarrassed, not used to taking a compliment, but people remember that stuff. And oftentimes it'll give them more autonomy and sense of empowerment, like, oh yeah, I am actually good at something. I have something to offer here, which can help with engagement. So examples would be, it's impressive how you managed to work 2 jobs and still squeeze in time for these sessions. Maybe you wish that they were coming more often, but when you look at their context, when you hear what they're telling you, maybe you can frame this in a positive way by appreciating that they are making time for their health in the midst of all this other stuff. Or I worked with someone who had been in a car crash, and she still woke up every morning to cook her family breakfast, even though it was painful for her to stand for that long. Even while struggling with this injury, you've been very dedicated to your family. And maybe the person's been beating themselves up for like not doing more for their family, but being able to highlight for them the ways in which they are doing well can be huge. You can say you're a great problem solver. They're really partnering with you on solving some of this stuff, or I really appreciate you sharing these stories. You can say, I'm so grateful that you're willing to let me know how we can make physical therapy more effective for you. This is a nice way to affirm if people are willing to tell you something that's not working or something that they need. It can be really hard to be assertive and voice those things. And if you as a provider can be like, yes, do it more, people are going to give you more helpful information, sometimes give you like the key to how to make something work better. It's really awesome how you rearranged your schedule to allow for a few minutes of exercise each day. Again, maybe you wish they were working out half an hour each day. Maybe you think that's what they really need, but this person is so overwhelmed, they have so many other priorities. You can at least affirm the thing that is going well, that they made a commitment, small commitment, but a commitment to change, and they're working on that. So I can see how for some people already your brains might be going towards, wow, this is going to take a lot of time. How am I going to get all of this in there? I don't know if I want them to be sharing a lot of stories. I have to bounce between 2 patients in every half hour or hour. And there have been a lot of studies showing that MI can be very brief, 5 minutes. So if you can get to the crux of something in 5 minutes, or you can really build rapport, or you can start their wheels turning about how to make a change, that's fantastic. And you don't need to take an hour and listen in depth to a whole long story in order for you to hear a couple of nuggets and give them a little affirmation or ask one open-ended question about the exercises. So don't feel like you need to have this epic 60-minute MI session to make progress. These are all tiny little things you can sprinkle in. Reflections and summaries. These help check that you and the patient are on the same page and offer opportunities for correction. So reflections are literally repeating what they say. You can literally say the last few words they said back to you. your patient's been talking about how they went to get on the train this morning, the train had broken down, and then the conductor said you had to wait for the next train, and that's why they're running late. And they also had this school project that was due, and they're just so overwhelmed lately, and they just barely even made it to physical therapy at all. And you can say, wow, barely made it. You heard all of this. Just reflect the last few things. And often that really makes people feel heard. You can also use synonyms like, close call. That's a close call for, or a synonym for barely making it. Paraphrase, again, just inferring the client's meaning, rephrasing what the client said. This can go hand in hand with reflecting emotion. Person is telling you that their parents are not willing to pay for their equipment for their sports team if they're not attending these sessions, and they hate coming to physical therapy because they have so many other things going on with their friends and their classes, but their parents have made them do this. And it's like, wow, so you're pretty frustrated with your parents, or you're pretty frustrated. See what they say. Is that the emotion that they're feeling? Try to hear what emotion might be going on and reflect it back to them. Especially with negative emotions, you can actually downregulate people's negative emotions just by labeling it. Some scientists think that just the act of reducing the uncertainty about what the emotion is by labeling it is helpful. So that's something to try. And then I put this picture on the reflection slide because you can choose to strategically change their reflection a little bit. So in this picture, you see the reflection does not match the person standing there. This can be helpful if you have someone telling you, I can't go on a walk because the city is too crowded and social distancing, and there's no interesting places to walk, and my walking shoes aren't comfortable, and they're telling you all this stuff. You can go, so it's pretty impossible to get out for a walk right now. And just saying something, we call them amplified reflections, that's rolling with the resistance. You're taking what they're saying, they're telling you all the reasons why they can't, and you go like, okay, so this is impossible. There's absolutely no way you could get out for a walk. And hold that as like a possible truth. I think when you actually hold it as a possible truth, then you're more convincing in saying this rather than seeming like you're trying to manipulate or trick them into saying something. Okay, this is impossible right now. And then that gives the client the opportunity to correct you in a really cool way where they can say, well, I mean, there's not no way I can get outside. I guess if I wore a mask and I went on this route, then I could get out for a walk. So you can explore reflections that are really just repeating or paraphrasing. You can reflect emotions, or you can play around with amplifying the reflection and exploring how the client responds to that. Summaries. So these are things that happen at transition points in the conversation. The person has given you tons of information about their treatment history or the reasons why they can't do something or whatever, and you're kind of wrapping up your discussion, or maybe you've gone through a few things and you've figured out a little bit of a plan for them, or they still have ambivalence. This is where you use a summary. So first you want to indicate you're making a summary. Let me see if I'm understanding so far, is maybe how you would open it. And that gives them a heads up that you're trying to check in with them. And then when you're giving your summary, you want to give special attention to change statements. So if the person has rattled off all of these reasons why they can't go for a walk or they can't do the exercises, but they've also mentioned being kind of worried about what will happen if they don't get with those exercises, you really emphasize in your summary that worry about getting back to normal if they don't start doing the exercises. You don't ignore everything else, but you might spend a little bit more time there. Or if they say, I know I can get a handle on this problem, like, awesome, they have some confidence. Loop that into your summary. If there's ambivalence, include both sides in the summary. On one hand, it feels really hard to not reach for the donuts. But on the other hand, you're pretty concerned about your blood sugar levels or your weight. And you want to end with the change point. So on one hand, you have struggled to get in those 45 minutes of exercise a few times a week. On the other hand, you've successfully done it for 4 out of the 7 days. So again, you're emphasizing what's going well, or what is that little wiggle room towards change. And be concise. Do not recount every detail they tell you. Choose the important details. I've run multiple workshops where we practice MI skills after looking at these slides. So often, people will give this summary that is as long or longer than what their mock patient said to them. Do not do this. The key is to notice big themes or important points. Think of taking notes in a class. You're not going to write down every single word the lecturer says. What are the main points? That's what you're doing in a summary. And then end with an invitation. Is there anything you want to add or correct here? And that, again, is so respectful. That's telling your patient, I care about what you think. I care whether I'm getting what you're telling me right. I care about understanding. So that's compassionate, that's evocation, that's partnership, that's all of these things. So now I just want to invite you to grab that piece of paper. Maybe you've been writing down notes. If not, you have this slide here that you can pause on so you can look at it. And I'd love for you to just think about a client that you have had in the past or that you have now who you've really struggled with engagement. And run through, what are some open-ended questions I could ask this person? What could I affirm? Where can I tell them they are actually doing a good job? What were some of the things they told me that I could have reflected on, summaries that I could have given them? And literally write it out. Write out the questions, write out the affirmation statements, write out the reflections, get all of this stuff down as a little bit of practice. So you can pause the slide here and jot those things down. So this next bit is particularly useful in a physical therapy setting, I think, because you are short on time often, you have important education that you're trying to provide for the patient, but you want to do that in an MI consistent way. So this is about how to share information with an MI framework. And the way you do this is called Elicit-Provide-Elicit. So first, you ask the person what they know about the topic. What do you know about the recovery timeline for this kind of injury? Maybe they know everything. You're like, cool, we don't need to spend too much time here. Or maybe they have something very wrong. And you go, okay, wow, we really need to correct this. Then you want to ask permission to share what you know. And if they say yes, provide that information. So would it be all right if I shared some information with you about how I see your recovery timeline? Give them space to answer. Sometimes they might not be having it. And in the spirit of partnership and having a good rapport, you might drop that for the day and go a different direction until they feel ready to take in that information. Most of the time they'll say yes, and then you can give them that information about the recovery timeline or whatever topic. And then you elicit client reactions to the information. Ask, how does that timeline sound to you? Or what thoughts or emotions kind of come up when I'm telling you this timeline? This can be huge. So many times patients will go home, whether it's from a therapy session in mental health or meeting with physical therapist, and their provider is like, yes, I gave them the info, things are good. And the patient is fuming, or they're overwhelmed, or they think this completely won't work for me, a million other things. And we as providers have no idea because we didn't ask and the patient didn't volunteer that. So this check-in can really allow us to tweak some things before waiting till their next appointment in a week or a month in order to correct misunderstanding or negative emotions that have attached to this idea. So even at the beginning of this presentation, you saw that I asked what you knew about the topic first. And if we had been in person, I might have asked, okay, now that you've shared all of this with me, would it be okay if I shared a little bit more about how I see these things? Just to model this for you. And at the end of this presentation, I'll try to get some of your reactions written down. And even though I can't hear those as you're doing this asynchronously, this is the model: elicit, provide, elicit. Another great MI skill that's easy and quick, because if you're strapped on time, you want the ones that you don't have to think too hard about to implement. You want stuff that's quick. So this is called an importance ruler. All you do is you plug in the target behavior to this sentence. How important is it for you to lose weight, start exercising, do the home exercises? On a scale of 1 to 10, where 1 is not important at all and 10 is very important. And then they respond saying whatever. Maybe they say 4. So 4 in importance. So you might reflect first. It's always great to reflect before moving on to another question. So it's a 4. Why'd you pick a 4 and not a 1? And this is called the backwards question because it's used to elicit change talk by looking backwards on the ruler. And this is, in essence, another way to get at why do they care about this change, to get them to tell you why this thing matters. Why would they want to engage in the exercise or the diet change? And then you might reflect back again what the client says, always with the reflection first, and ask a forwards question. So what would need to happen to get you from a 4 on importance to a 7? And you don't want to go up to a 10. That's a little overwhelming. You always kind of want to be thinking in smaller increments on the ruler here. That's why if they said originally it's an 8 in importance, you wouldn't say, why is it an 8 and not a 1? You might say, why is it an 8 and not a 5? And so to come back to this forwards question, you're asking what would need to happen to get you from a 4 to a 7? And that's giving them the chance to tell you concrete things that the person would need to see in order for this to matter more to them, AKA targets for motivation. They are letting you know what needs to be tinkered with in order for them to prioritize this more. You can jot this down on a paper that you have on your clipboard and just basically eyeball it and then read it to the person. It's a great thing to practice with, kids or family members who are not totally making a change that they keep telling you they want to make. Like, these skills are awesome with people who you know, because they're not all about therapy. Some of it is just understanding what's going on with the person and their barriers and their successes. So you can definitely play around with all of these with the people in your life as a way of practicing. So after you do this importance ruler, they might have been a 10 out of 10. And you're thinking, okay, they're 10 out of 10 for importance. Why is this not working? Then the confidence ruler. Again, same idea. You're just asking this as written. If you decided to make this change, how confident are you that you could do it on the same scale, where 1 is you're not confident at all and 10 is very confident? And again, say they give you a 4. Backwards question, same as the last slide. So why did you pick a 4 and not a 1? Reflect back what they say to you. Move to the forwards question. And what would need to happen to get you from a 4 to a 7? Someone out there is probably wondering, what happens if this person says it's a 1 for importance, like they don't care at all? You can still ask an open-ended question. You can say, okay, so you're telling me this is a 1, that it's not important to you at all. What's bringing you to physical therapy each week? Get a sense of some of those things. Maybe there will be a spot that you can pick out of there to use as motivation in your reflection back to them. So confidence and importance rulers. So now that we're nearing the end of the presentation, I just want to get a sense from you. Why is it important to use MI? You've heard me share all of this information. Why do you feel like this is important? So if you want to just pause here, jot down some notes for yourself about why you care, why you're here, why MI might be important for your practice, and then rejoin me whenever you're ready. This slide is helpful for figuring out continued work with motivational interviewing. So we have good data to suggest that these trainings can fall out of your brain as soon as you've minimized the window. So how will you use what you learned in this training? And if you want to pause here and jot down some strategies. And then as you're coming back into the video, if it's okay, I would love to share some thoughts about things that have worked for other providers who I've trained in terms of continuing their practice of MI. So having an accountability buddy, maybe a colleague who you can work on this with, or maybe you have a friend who works in a different discipline, but where MI might be useful. Maybe they're in mental health, or they're a primary care doctor, or they're a lawyer who's just trying to deal with their colleagues. Think about ways that you can tell each other, I used a reflection today and then an open-ended question, the person totally came alive, or struggles that you've had. I tried to use a confidence ruler and it just really didn't seem to land. Do you have any suggestions? It's great to have someone to check in with. Another wonderful strategy is setting an alarm on your phone or writing a note in your calendar for every month. Just blocking out 5 minutes that you can spend to think about how to apply these skills anew in your practice. And maybe that'll be going back to the OARS skills, thinking about your patient roster and going, okay, Jeremy really seems like he could benefit from some of this. Let me write out some OARS ideas for my next session with Jeremy. And that way you don't forget that these are tools that you have. And it gives you a little bit of set space to remind yourself and bring the skills back to the front of your mind. If you have questions or thoughts, I would love to hear from you. This is my email, shelleykind@gmail.com. Happy to answer questions, chat with any of you more. I'm very grateful that I had the chance to work at the Ryan Center at Boston University, to all the physical therapists there who let me shadow, who were true partners with me in learning how to have an interdisciplinary team approach. And I'm very grateful to Dr. John Otis, who's my supervisor on this presentation, and for the whole behavioral medicine training that I had. And lastly, I'm extremely grateful to all of you for sitting through this and exploring the written down strategies at home, and for thinking about how you might integrate MI into your practice in the future. Thank you so much for your time.